UP, CIM, St. Luke's, PLM, UARM, UST, West Visayas,
Ateneo,
St. Louis University. These are the top performing medical schools in the Philippines, at least based on the October 2024 licensure exam. Around 10,000 aspiring doctors took the test and only about 55% passed. So let's talk about how the Philippines makes its doctors. This idea has been sitting in my mind ever since I made the Philippine healthcare system video. But what really pushed me to finally start doing the research was a post from the Association of Philippine Medical Colleges, or APMC, recommending a cap of duty hours for medical students. Specifically, clerks or fourth-year medical students would be limited to 16-hour shifts and interns to 12-hour shifts per day. That's a huge deal, and for the record, I am going to say it right now, I fully support this change 100%. Let's zoom out a bit. In the Philippines, the pathway of becoming a doctor looks like this. Kindergarten to high school, 4 years of college, usually a pre-med course, 4 years of medical school, then you're required to do 1 year of internship before you're allowed to take the Philippine board exam. If you pass, you're a licensed physician and can practice as such. If you fail, you can try again. Or not, up to you. You can probably find happiness and contentment your own way eventually. For those still interested in medicine, please review the Republic Act 2382 or the Medical Act of 1959 for more details. Yes, the law is as old as a boomer. Now, focusing back on the fourth year medical school, this is what we call a clerkship year. This is when students start working in the hospital and applying the theories they've been cramming for years and finally getting hands-on clinical experience in patient care. Each school does it differently, but many, or at least my school, use what we call a pre-duty from system. And here's how it works. You're assigned to a team, say team A, B, or C, and let's follow Dr. A. Monday is your pre-duty. It's a 10-hour shift. That's 7 a.m. to 5 p.m. You go home and you go rest. Tuesday is your duty day. It's a 24-hour shift that starts 7 a.m. and ends 7 a.m. the next day, which is Wednesday. Your from status. You're not done yet. You're supposed to stay until 5 p.m., maybe 7 p.m. to do the notes, maybe attend lectures or help your colleagues because the hospital is always short-staffed and everyone is drowning. Then guess what? Thursday, you're pre-duty again, another 10 hours. And on Friday, back to another 24-hour duty shift. If you're lucky, the weekends will give you some break because free and prom status don't work during the weekends. However, that's still a minimum of 78 hours a week. And if you start the week as Team B or Team C, you might be working over 100 plus hours. As you can see, this cycle continues every week for the rest of the year unless you're on elective or community medicine rotation. I'm not here to dive into horror stories about what happens during duty days. That varies a lot depending on your hospital, and honestly, I had a decent experience. It's not so bad, guys. With tuition fees now reaching 200,000 per semester, that's 400,000 a year. Our medical school told us back during our clerkship year that the reason we had to work so hard was to turn us into quote-unquote better doctors and to prepare us for residency training. By the way, residency training is another 3 to 7 years of this grueling pre-duty from grind, especially if you train in the Philippines. You can survive it for sure, but it's gonna be up to you. And just to be fair to those who argue against reducing the work hours, claiming it will degrade the quality of doctors trained in the Philippines, I kinda understand where they're coming from. Let's talk about it. A 2012 paper raised concerns about negative impacts of limiting residency work hours in the US. Many of these claims have since been debunked. Multiple systematic reviews now show no significant difference in domains of patient safety and training quality between residents with longer versus shorter work hours. In fact, many of the following research highlights downsides of excessive work hours. Serious downsides like increased rates of accidents, mental health issues, suicidal ideations. Looking back at those articles, some concerns, though lacking in solid evidence, caught my attention. Specifically, the concerns about professionalism and work ethic. These are abstract concepts that are hard to define, let alone quantify. The fear is that by limiting work hours, doctors in training will start thinking more like shift workers and less like lifelong stewards of patient care. Remember, doctors are already delaying their personal milestones like getting a job, buying a house, getting married, or starting a family just to study medicine. Some worry that the culture of self-sacrifice of putting patients first no matter what might disappear because of these shorter work hours and all this wellness bullshit. I remember clearly that during my medical school application and interview, I was asked, am I okay not having holidays or weekends for months or even years during my training. And if it's my day off and my team needs my help, will I answer the call and go back to the hospital? Back then, I gave an honest yes, not because I truly believed it was right, but because I understood that it was the culture and the expectation. I was prepared to do what was needed, even if it meant pushing myself to the brink of exhaustion and burnout. That's the kind of work ethic deeply ingrained in the Philippine medical training. And yes, maybe the experience shaped me into a quote unquote better doctor by some standard. And for that, I'm grateful. However, it's also one of the main reasons I eventually left the country and practiced elsewhere. The training system in the Philippines is slowly improving. With more time, students can dive deeper into pathophysiology, explore the latest research in diagnostics and treatment, truly learn medicine, not just survive medicine like many of us did during clerks and interns. More importantly, they'll have time to live, to do the laundry, to buy groceries, to pay bills, take care of their health, see their own doctors, and yes, exercise. Please, exercise. They can reconnect with neglected hobbies, pump out those MMRs, and make YouTube videos. It's their turn to prove skeptics wrong that a change in mindset, a humane reduction in work hours can be good for doctors, patients, and society. There's more I'd like to talk about, like who's actually benefiting from overwork residents. But that's a topic for another video. If you're curious now, I'll point you to the Sheriff of Sodium video that kinda answers the question. Now shifting gears to part 2. Are we planning to train more Filipino doctors just to go abroad? The Philippines is working to address its doctor shortage by opening more state universities and increasing funding for medical education. Multiple laws and implementing rules and regulations have since been enacted, and these are good initial steps to help increase the number of doctors in the country. There are studies supporting this notion. My personal opinion, though, is that the problem isn't a shortage of physicians. It's a distribution problem. Most healthcare providers are clustered in urban centers. So if you're a fresh grad in a big city like Manila, Cebu, or Davao, it may be tough to find work as a new GP or a junior consultant. But if you go rural, the patients might not be able to afford your care. Many of us know the memes of doctors in the provinces getting paid in eggs and vegetables instead of money. It's less common now, but the sentiment still rings true. Occasionally, I see posts in social media reminding people that not all doctors are wealthy or some shit like that. Because doctors in the Philippines, especially when they're just starting out, they're not exactly having a great time. Other factors also affecting MD retentions in rural areas include geographic isolation, burnout, poor access to electricity, telecommunications, and potable water. Yes, the Philippines still has some areas without potable water. They probably get frustrated from the lack of support from the host LGUs and the national government, and also because of that, they're probably experiencing some security and safety concerns. I'd like to talk about DTTB more in a future video, but the point is, increasing the number of medical graduates is only a short-term fix. What I think will actually happen is we'll just see more and more MDs who will start out practicing in the Philippines and then will leave the country as soon as they can. It's starting to feel like medicine is becoming the new nursing. Another profession we're training people in, mainly to work abroad. There's a great Vox video on how the Philippines became the top exporter of nurses. I highly recommend it. The main takeaway is that there are lots of factors pushing young professionals out of the country, causing the brain drain, on top of the factors pulling them away from the Philippines, like better salary, better working conditions, and more resources to actually practice medicine. And let's be real, training professionals for export bring in extra revenue. So yeah, both the government and the many Filipino families are benefiting from this setup. So I'm not really sure if it's a problem or not, but let's talk about solutions. I'm not smart enough to give any concrete actionable solutions, but like politicians during election season, I could mention key phrases that sound really good, like we should reform the Philippine medical education system and help improve the working conditions of all healthcare workers in the Philippines. The changes we're seeing today are not perfect, but they are great steps towards the right direction. Let's revisit the Philippine Medical Act of 1959 and consider adding medical residents under the protections of the Philippine Labor Code. Residents are workers too, and it's time for us to acknowledge that legally. Let's create meaningful incentives for rural practice physicians so they'll decide to stay. We should enact policies that encourage collaboration between the LGUs, the national government, and the private sector to help empower the doctors already in the barrios. And finally, let's scrutinize this humans for export practice that the Philippines is heavily leaning on. If you really think about it, building an economy around sending our people abroad just to survive, separating them from friends and family for months and years on end, is kind of disgusting. Let's examine what leads to this process and make the Philippines better, not just for healthcare workers, but for all Filipino people. I do hope I published this video before the 2025 general election. The timing is not intentional, like I said. This idea has been simmering in my mind for quite some time now. If you're eligible to vote, please vote. And I hope this video sparks meaningful conversation with your friends and family while you're at it. If you're a doctor or healthcare worker trained in the Philippines, can you share some of your experiences in the comments below? Horror stories or wholesome moments, whatever. I'm curious to know. Or just say hi. Everyone is welcome here. Thanks for watching. Peace.